Hello everyone, I'm Romania Fernando. I'm a physiotherapist affiliated to IIT, the National Center for Disability in Sri Lanka, attached to Faculty of Medicine, University of Canada. And also I'm a research assistant affiliated to the study of developing a cerebral palsy register for Sri Lanka. So today I'm going to talk about in this session with regard to physiotherapy management in early intervention. I would like to elaborate more of holistic approach in early intervention program and how the components, management and intervention will approach in the aspect of neonatal. So as you can see, I would like to describe about the overview of today's session as how to identify the goals of early intervention and what are the components and strategies that we use. What are the key milestone identification, how the specification and how the approach is being done? What are the assessments and outcome measures according to the clinical context? What are the interventional strategies we use? And I would like to talk about the follow-up sessions and the importance of routine follow-up. When discussing about goals of early intervention, the collaborative entry or the multidisciplinary team approach is very important. Always, the child and the family or the caregiver should be a centrifuge icon. We should always make them as the center of our approach, where the pediatrician, medical consultant, and nurse or the midwife, physiotherapist, occupational therapist, speech and language therapist, and all other professionals in different stratas will provide a collaborative service provision to this centrifuge icon where the family child consider as our main priority. So always, these goals of early intervention should emphasize a child-centered nature, a family-focused nature, where this should be a strength-based protocol where it helps to enhance motivation of the family and about the participation and how the goals, how these identified goals become realized or the realization of goals with the help of caretakers, and we have to discuss about the positive outcomes. We shouldn't forget that the family empowerment, inclusion, and making decision with collaborative with family is very much important thing. So now I have extracted here some international uh, evidence-based uh, evidence-based approaches such as EI Smart, where we bestowed early intervention programs for infants at high risk. So where the EI, SMAAT or early intervention, sensoriomotor development, attention and regulation relationships and therapist support, which elaborates these words, is another way of describing how a multidisciplinary approach is being supported with the connection of family and the child or the caretaker. So these standardized methods are defined by uh, literature review, and I have mentioned this GAME or the GAME, which describes goal active motor enrichment, which creates an enriched environment to infants and the neonates, which improves their inner strategies of inner inner learning strategies, where the motor outcomes in aspects of sensory, cognitive, motor outcomes are being enhanced with an enriched environment. This affects the neonates environment and as well as the future or the development of neonates in a holistic approach. So now I'm going to talk about the assessments and outcomes. Assessments are important benchmark that we have to do. Where now out of these assessments, I have mentioned as motor dysfunction, which is an important clinical criteria in diagnosis of high-risk babies of early intervention when when conducting an intervention program, these assessments and outcome measurements are very important. So if infant is having a reduced quality of movements, as you have learned in previous sessions about the general movements, if the abnormal general movements or the in writing period, so all these general, if the general movements show any neurological abnormality, as well as if the infant shows low hind scores, and as well as the chronological age appropriate is less than the expected, uh, the milestone achievement is less than the chronological age expected expectancy, then we have to be alert on our out, uh, intervention program, that we have to definitely see the holistic approach in early intervention program, which needs to be included an intensive interventional program. So the standardized investigations are mentioned here, which are mandatory to be seen, or which are mandatory to assess in high-risk babies. Now, this HIND, or the Hammersmith Infant Neurological Examination, is a very important and a very sensitive standardized neurological examination, which based on outcome of score-based system. It also covers main components such as cranial nerves, tone, posture, movement, likewise. So this HIND, or the Hammersmith Infant Examination, is an important tool where I explain in the below, where I have explained some benchmarks, or the uh, some outcomes that I have mentioned, and the general movements, or the GMs, as well as abnormal neuroimaging should synchronize together in order to have a clear-cut idea about the outcome measurements or the clinical investigation of high-risk babies, and this should be done, or these assessments are mandatory, even if we notice any of the abnormality in one of the components. So as I have mentioned, if the child is less than 5 months and Heinz scores are less than 57, then there is a risk of being a predictive of cerebral palsy. And if the child is more than 5 months and if the scores are less than 73 at 6, 9, or 12 months, then it is also considered as a high risk of cerebral palsy. And these scores are internationally standardized and validated evidence-based scores, which has given many positive outcome measurements. So now I'm going to talk about the GMFCS curves. So what is the importance of these GMFCS curves? These GMFCS curves can be used to describe the patterns of gross motor function, so for children with overtime, and it also helps to estimate the child's future motor capabilities. So these, as I've told, now in the first, this whole session will focus on the first 12 months, even though I want to focus more on the first 3 months of the neonate, of the child. Now, as you can see, even in the GMFCS curves, in the first 3 years, the therapeutic window of being improved, the estimated outcome on the child's future motor capabilities are quite high. So early the better, where the referral or the intervention is being given in early, there's a more window that the improvement can be grown to a higher GMFCS level. So this is very much important to keep in mind, the importance of early intervention and level of improvement. GMFM is another standardized tool, which is an observational instrument tool to measure about the gross motor function, measure outcome. It helps to measure the changes in gross motor function. This will be starting doing from 6 months onwards. It consists of 5 main categories of gross motor development, such as lying and rolling, sitting, crawling and kneeling, standing, walking, running, and jumping. So out of these, there are certain percentages given, and out of those percentages, a goal score being created or calculated for the benefit of child's future motor development. BMS, or the basic motor skills, is an assessment for Down syndrome kids from 3 months onwards in order to assess the basic motor skills. Now I will be moving to the components of management. Always we have to keep in mind why and how the management should approach, and it should be individualized to each and every individual, or each and every infant or the child. So identification of milestones and achievement is very important, because we are not going backward, we have to go forward. So with a creative idea and with a creative mindset, how these milestones can achieve, or the to achieve future milestone capabilities. And we have to always keep in mind the age appropriateness, the level of achievement. So all these factors will be an impact for the milestone achievement. And functional activities would be the ultimate goal of child's activity level, where the child should be happy and independent in society. So this should be trained from early childhood, where the functional activities have to be the functional activities have to be purposeful, and it should be something which gives child a happy environment. Always this active motor learning, the active component is very important, because nothing will be do in passive. This active motor learning will improve the neuroplasticity of the brain, and movement stimulation accompanied with positioning and handling creates again an enriched environment, which I explained on previous slides. I have put some milestone achievements, especially I have focused on first 3 months, but there will be because this is very much important to get an overall idea about the milestone achievements. As you can see, now this is the first 3 months, from 4 to 6 months, from 6 to 9 months. So these are all, now here it shows 9 to 12 months. All these are age appropriate milestone achievements. So now I'm going to talk about the active motor learning with movement stimulation. I have been using some videos to show you all how this active motor learning will occur in an enriched environment. Now this baby is in a perfect position, because uh, for this child to have functional reaching, the environment is adapted as an enriched environment, and with a great precision, and it also with movement stimulation, where the child is actively trying to participate and trying to reach to the target based activity. Always the task should be goal oriented. Even from that goal that which we are setting, the outcome should be a purposeful outcome or a purposeful activity. Now as you can see in this video, where the child another trying to achieve another milestone. So for that, we are not doing it in a passive way, we are not giving any help for her, but doing it in a very methodical way, giving a movement stimulation in an enriched environment in a perfect position, which helps baby to achieve what she needs with an active motor movement stimulation, which improves her or the baby's neuroplasticity. So now here again I have shown some more videos, which now this will give you an idea about the positions that we should place in physiotherapy management, how the position or the body the of the child, where the baby will be able to maintain bimanual activities, reaching, movement stimulation, and even the by like using these kind of very simple and nice toys. And it should be whatever the task that we ask, what be the task that we are performing, it should be a very much purposeful way. It's just not keeping the toys and show asking we are not taking passively the baby's hand or the leg and do it, but with the help of doing with the help of these toys or the equipments, what we're going to gain is the active movement of child in active movement, active stimulation. So again, this baby is trying to keep in a very nice position. So this will draw their attention and they try to explore. This will create an enriched environment. And these are some of the positions again. Now this whatever the goal of the setting, see the position, how the weight bearing takes place, and that none of these are doing by passively, just giving a stimulation. The child is trying to explore what is this. So the bimanual activities, even likewise. So again, you can see in this another position that we have made, say, set for this baby. So she's trying to explore, and the age appropriately milestone achievement is being done with a, as you can see now, this is a creeping, and the child is trying to take that, but with an enriched environment, she is trying to achieve it. So another uh, milestone achievement that like improving movement stimulation actively in different in standing position. So yeah, now I'm going to talk about the important positioning of babies. uh, Tummy time. Now this shouldn't be done in a separate time where you need to find a separate day or a time. Why, whenever you change a nappy, whenever you play with the baby, whenever you read a storybook, place a child like this, which helps to improve the hip movements of the child and will later improve the walking ability and the forward propelling. So this will help the like child's inner drive to explore, communication, skin to skin contact, nurturing care, enrich environment. These positions aren't made only to place a child. With the help of this position, we need to keep in mind always, always to interact with baby in different ways, whatever the way that you can. Even as you can see, placing baby uh, on on this kind of position, talking to baby, eye to eye contact. So carrying baby in this way, which helps to ease their tone. So these all these positioning, active stimulation are combined together. Handling and carrying, I would like to show this video for you all, how the importance of this carrying or the handling whenever you're taking baby from bed to yourself and when carrying. And also when you're keeping the child, it is very much important to uh, follow the right way, because this will later in future helps baby to achieve gross motor development or the milestone achievement. Also, this will help baby to do active stimulations. Now, as you can see, yes, I'm playing that video again, how to keep the baby on the mat, and then with the minimal support, placing the child's elbow, and then yes, now she's very comfy, very comfortable. And as you can see, these are some more other few ways that we could carry baby. So these are clinically standardized and evidence-based practice, which helps baby to explore the world. Which just taking the baby in a supine way, they won't see the surrounding, but with a best carrying position, the child is happy, the family is happy, so then the environment is enriched. And as you can see, I have input this movement stimulation and visual stimulation together. The child is doing activities in a CVA friendly environment where the visual stimulation is more. Now she is trying to explore the thing, so she is trying to reach. Now in a not even in a non-severe friendly environment, these achievements would have not occur, but with the help of these environmental friendly icons or the setting, we are trying to reach it. Likewise, And from this video, you can see how nicely the reaching and the reaching occurs. So where the single-handedness and where the child is happy to take that and explore what is this, and just doing a just doing an activity does not give any interest to baby. So always make sure that the child should be, we have to gain the interest by giving an inner drive to uh, do a em- to carry out an activity. So these are some of the creative activities that have been done. So these are like to gain the bimanual reaching, the activities and kicking, all these gross motor achievements and movement stimulation of children. We have used these positions. So evidence-based interventions, yes, these are evidence-based interventions. Always, as you like in previous slides, I was always talking about the term active. Yes, active involvement of children are very important, because then only the neuroplasticity, their brains develop, because infants have the capacity or the capability of learning new things. We have to give them the opportunity by creating a purposeful task. It should be a goal oriented task which always give them a purposeful activity. And each and every protocol of therapy not same to each and everyone. That should be individualized and customized one. And the surrounding, the activity that we make should be creative. It shouldn't be bored to the infant. Make sure not only the therapist is not the person who is doing that, but with the involvement of the therapist, parent family involvement is 100%. At home, child is dealing with parent and family. So the family centered, family child care therapy, parent, family, child, caregiver, therapist should be in a, they should be on board, and it should be a 360-degree care in every aspect. Always activity should be fun or play-based activity. So routine follow-ups are important. Why? Because we are having individualized interventional sessions. From these routine follow-ups, we could take a sustainability, we could make this sustainable with the outcome measurements, with the gross motor achievements. We could see to which side to which stream now the child should be direct. So from neonatal period to the neonatal period onwards, the child should be on board with 360-degree care. So again, these outcome measurements and improvements are should be individually we have to monitor, and we have to make a sustainable, goal-oriented, realistic protocol. And this program should be consistent always, even to the end. The family child therapist introduction and involvement is very much important. So thank you very much for joining this session. I hope that you gain some important facts on this. Uh, yeah, thank you very much.